It's 19th of June, a day designated as a World Sickle Cell Day. This day was chosen to raise awareness internationally about sickle cell disease. What is sickle cell disease? Most red blood cells are around normally, which allow them to travel and carry oxygen throughout the body. Sickle cell disease is a chronic blood disease that causes the hemoglobin in the red blood cells to take an abnormal C shape or a sickle shape. These sickle cells have a harder time traveling through the body. They also die faster than healthy blood cells and can cause what is known as sickle cell anemia. Sickle cell disease affects many people. They were formerly called sicklers. They are called warrior now, not sickler anymore. Many of those warriors needed more than 1,000 blood transfusions as treatment to help them manage severe recurring episodes of pain and fatigue. Sickle cell disease occurs in 1 out of every 365 black men or African American births and affects 100,000 Americans. How can you help? By being a blood donor, you can give sickle cell anemia patients a chance at a normal life. For instance, to return to school, dance, play, sport, volunteering, and many more. Support patients this World Sickle Cell Day by scheduling a donation at a Red Cross center or hospitals near you. Please listen to Professor Maxwell and Nkoli of AIT of Kakaki program for further enlightenment.
At the World Sickle Cell Day, to analyze some of the issues, the causes, and possible prevention of the disease. Professor Maxwell Nwegu is joining us now right here in the studio. He is a professor of chemical pathology. There was a past dean, Faculty of Basic Clinical Sciences, College of Health Sciences in the University of Abuja, and he's now the current head chemical pathology department in the same university. Thank you so much, Prof, for coming to join us. All right. Also joining us is Salamatu Yahya. Salamatu Yahya is a mother of a sickle cell warrior. Thank you so much, Salamatu, and welcome to the studio. All right, Prof, let's begin with you. First of all, help us shed light on the challenges faced by individuals with sickle cell disease and their families.
Thank you very much. I think first, back to what you asked. Sickle cell disease is one of those diseases or disorders that we take as having a multi-systemic set of problems. So virtually every organ in the body can be affected. So that tells you the magnitude of the challenges that you hope to encounter medically. Okay. Outside of the medical challenges, there are also social challenges. Outside of those social challenges, there are economic challenges. Why? Because the disease takes a toll on the economies of homes where those warriors are. There are social challenges in terms of stigmatization, inability of the warriors themselves to be to fit properly within the societies because of some of the challenges they have, in addition to the medical challenges. And outside of all these three, then we have the challenges that have to do with knowledge, awareness, community engagement, and stakeholder involvement as regards the disease itself. So you see that it is something that cuts across a lot of challenges in terms of when you say challenges with awareness and many people don't know what their status is. Maybe for most of us, it will be at the point at which maybe we're about to get married because the church requires it or the mosque. That's when we go for screening. So it creates a lot of challenge because if you don't know early, then the tendency is that you're going to have problems going forward. So I think maybe in the course of this discussion, we'll begin to look in depth at some of those challenges.
All right. So for those that you talked about awareness creation here, for those who do not understand what it means to have sickle cell, What exactly does it mean? What happens to the body that can identify you as a sickle cell patient warrior?
Okay, I think the best way to look at it is to explain it. It's an inherited disease. That means it's a problem with the genes. It's inherited and it affects the blood cells, the red blood cells. And we know one of the key things about the red blood cells is that it's what transports oxygen around the body. So it causes the red blood cells to be unable to effectively transport oxygen. And we know that cells, tissues, organs need oxygen for life to survive. So with that, that gives us an idea of what sickle cell does. And that means that virtually any organ in the body can be affected because every organ in the body requires oxygen. So it's an inherited disease with a genetic problem, an abnormal gene leading to the production of abnormal red cells. I think that's the best
way to explain it. Okay, we'll come back to you to find out if this disease is avoidable and what one can do. If you say it's an inherited disease, it means a child gets it from the parents. Yes. So we'll find out what happens with the parents for the child to be affected that way. So let's come to anyway. Right before I go to Salamatu, why are they called warriors instead of patients?
I think it's a better nomenclature for the disorder in terms of the fact that these are people who are surviving against the odds. So we prefer to call them warriors instead of patients. The patient aspect seems to be a little bit, some people will say sickles and all that. That's sort of derogatory. We don't use that anymore. We use warriors, and it's something to help the patient see that, look,
you're getting by.
Yes, you're getting by, and it's something that's surmountable.
Okay, surmountable.
Yeah.
We'll come to that. So let's come to you, Salamatu. You're a mother of a sickle cell warrior. Okay, so tell us, how has it been managing the situation?
Thank God for Almighty Allah for giving me this child. I did not prepare for it, but
I understand it's difficult really about just trying to see how we can help us, because there are so many women out there who are also going through the same kind of challenge, and they've been learning from your experience and how far you've been able to go through.
Sickle cell warriors is not a death sentence, but it's a challenge that one day you pass through it.
Yeah, you're communicating. I can understand. Yeah, right.
That one day you pass through it. But one thing I want to say is that if you take care of them the way it's supposed, you will not be having too much challenges.
Okay, let me put it differently. How old is your warrior now?
He's a year 7 months.
A year 7 months.
Yes.
Okay. At what point did you notice that he was a boy and girl?
A boy.
A boy. At what point did you notice that he was a warrior, and were you aware of the factors that could lead to that before you got married?
No.
No one told you about it?
No.
You didn't hear anything about it from anywhere?
No.
Okay. So, at what point did you now discover after having the child?
A month.
Okay.
He was a month old.
Okay. So, what were the things that you discovered that made you start seeking medical intervention for the warrior?
Because my third baby, she's a sickle cell. So when we are going to clinic, they always tell us that if you put to bed, come for newborn baby screening before 5 weeks. So when he was 4 weeks, we went for screening. So that is when I Sky News.
Okay. And you've been managing and following doctor's instructions.
Yes.
So that brings us to going to this newborn screening that she talked about. Dr. Prof, tell us what this is all about, because the whole focus of this interview is to raise awareness on that newborn screening, because from what she said, it was just that information that made her know exactly what she's dealing with.
Yeah. It's good that Mommy Afis just mentioned the fact that she knew within a month. Hers is a different case from many other people, probably because she already had an older child that also was a sickle cell warrior. So it was easy for her to get to know about sickle cell disease, such that when they talk to them as pregnant women that, look, you can do this screening and all that, she was able to do it within a month. So what it also tells us is that you can actually detect it very early. Okay? The newborn screening is basically a process by which you try to look at newborn babies and see whether they have sickle cell disease or not. Usually at the early stage, they look just like every other baby. You won't, for the next couple of months, you're not going to have symptoms or anything. So the only way you will know is by screening, by doing a diagnostic test. So most of in advanced countries, they do it as part of, once a baby is born, they just collect the blood and all that. And that is part of what we're trying to do in country now, especially with the program that is going on within the FCT and also in Kaduna State, which are the two sites in Nigeria. That will bring me to what we call the CONSA program. So the CONSA program is the Consortium on Newborn Screening for Africa. It's a program of the American Society of Hematology. So about 7 countries in Africa, they started off that program in 2020 to screen newborns. And Nigeria, fortunately, is the only country that has 2 sites. Usually it's 1 site per nation. But Nigeria, like I mentioned, we have in Abuja and we also have in Kaduna. What do we try to do? Newborn babies, at that point, you try to screen and diagnose them for sickle cell disease, because early diagnosis is key to what will happen later on in their life. Because if you detect it early, then you can intervene early and prevent rapid or early onset of the complications that come with the disease. You start giving interventions and certain drugs. So that is newborn screening. And basically what is done is this: you have a newborn, just a little bit of blood is collected, usually from the heel of the baby, onto a piece of paper, filter paper, just a drop, 1, 2, maybe about 3, 4 drops. And that's all. And you take it to the lab and you check to see whether there is sickle cell disease or not. So that's basically what the newborn screening is all about. Within the FCT, we are doing it, that's under the auspices of the Center for Excellence in Sickle Cell Research and Training, University of Abuja. We are doing it in about 22 sites, primary health center sites across the FCT, over 4 area councils: Gwagwalada, Kwali, Kuche, Buhari, and then Abuja Municipal Area Council. 22 primary health center sites. So we go in there and these newborns. Now, because some people deliver at home, sometimes it's difficult to, so we devise a system where we go using the immunization period, because even those some mothers deliver at home, most of them will still come for the routine immunization for babies.
And those are attended by traditional birth attendants?
Yes, including, yes, many still bring them because of the EPI program. Okay, so during the immunization clinics, we come in there for those that were not able to see at the point of birth, that didn't deliver in those centers. You can still do that. So for the program, it is basically those who are the babies who are less than 3 months, based on the protocol for the funding organization. Remember I said it's the American Society for Hematology. So any baby that is less than 3 months that we see even in those immunization clinics are part and parcel of it. and those that we get directly at the point of delivery within the hospitals.
So does this mean this intervention is completely free?
Yes, it's funded and it's free. So the screening is free.
Okay, so the worry for many Nigerians is the fact that this screening is done for newborn, meaning you would have had the baby who has this challenge, so to speak, before you carry out the test and discover, and then you start treatment on time. But okay, before I go back to whether it could be avoided before you even have that baby at all, let's look at that early intervention, therapeutic intervention. What does it do for the warrior? Does it help live up to what certain age, or does it take care of the child for the entire lifetime?
Okay, so basically the intervention helps to, in medicine we use two words, morbidity and mortality. Morbidity just means the various complications and things that will arise from the disease process. Mortality means death. Early intervention tends to ameliorate the morbidity associated with the disorder, and also, of course, invariably prolong the lifespan of the child. So early intervention will ensure that these children live to adulthood. You know, Mommy Hafiz just said that it's not a death sentence. It's not. There are people, there are sickle cell disease warriors that live to 60-something, 50-something, you know, abroad 50-something. Even in Nigeria, we have those who live till 60-something. Some months back, we lost someone who was 65 or thereabouts. So it's not a death sentence. As long as it's detected early, you begin early intervention. There are drugs that you use, and then you teach the mother and other things to do to ensure that that child lives a relatively normal kind of life and can stay on to adulthood.
Does that also involve diet? Some form of diet or nutrition?
Yes, because diet also involves things as simple as water, and water is key when you talk about the sickle cell disease warrior.
Okay, so let's go back to what I said earlier, preventing this from happening at all. Is it it's a genetic disease which you inherit from your parents, like you clearly stated, but is it avoidable?
Yes, it is.
So how do you do that?
So now I'll need to do a little bit of genetics. So let me put it this way. We have a type of the protein inside the red cell that carries the oxygen. We call it hemoglobin. And the normal hemoglobin should be A, right? But we have variants of this hemoglobin, which include F, include C. So if you inherit hemoglobin A, usually you inherit from your mom and you inherit from your dad. That's 2 points now. If you inherit hemoglobin A from your mom and hemoglobin A from your dad, you have AA. That is fine, right? If you inherit hemoglobin A from your mom and hemoglobin S from your dad, yes, you inherited one sickle cell genetic part, but you still have an A from your mom. You'll be AS, and you will live relatively normal life, just like the AA, okay? But if you inherit hemoglobin S from your mom and also hemoglobin S from your dad, that will give you SS. Or S from your mom and C from your dad, that will give you SC. And those are the two commonest causes of sickle cell disease, SS and SC. And how do you inherit that? Everybody has two, right? So AA, everything will end up as AA. But if you have two people who have AS and AS, we call them carriers. Carriers because A is normal, but S is what? The sickle cell one. So if you have a dad AS, a mom AS, you see that when you do the cross tabulation, there's likely going to be an S from the father and an S from the mother. So that is part of why when we say people should know their status, and they try to advise people, they say, look, if you're a carrier, you should try not to, for instance, marry a carrier because there's the chance. You could be lucky, with God on your side, where because you're AS, all that you have is AA or AS. Do you understand? But remember, you have one S from the father and you have one S from the mother. It could end up that even all the babies are SS. Mommy Hafiz, because she's one of high. But there are two others that are
very free
of it. So that tells you what can possibly happen. That's like 50%. Okay? And she's not a sickle cell disease patient, and neither is her husband. So that is the kind of position that we see, or the kind of inheritance that can occur. And definitely, if somebody is a sickle cell disease patient, that person should try to marry an AA, because you already have two S's. So you're definitely going to give your baby an S. So it behooves that you should get someone else who has AA, such that at least it's AS that you're going to end up with. Because if you take someone who is a carrier who was AS, the tendency is that you've increased the chances of having SS babies. So I think that's in a way that I can explain it for people to understand that it's inherited, but it's preventable. So how is it preventable? By knowing your status. If you know your status, then you'll be able to know, where should I get involved in a relationship or not?
Okay, fine. So let's come back to you now. You have two children who are warriors now, so to speak. That is not an easy task to deal with, right? So when it comes to affording the medical treatment or maybe going to the hospital to seek this health care, do you get some incentives or you all foot all the bill from your out of pocket?
Yes, sometimes I find it difficult, and sometimes with the help of God and my family members, I find it easy. But sometimes the transport to hospitals is very difficult for me. But thank God for life. With the help of hospital and the hematology, I find it easy.
So how often do you go to the hospital, to deal with this issue? And sometimes we hear things like an attack, maybe at the middle of the night or something like that. Do you experience all of that?
Yes, ma'am. I normally go to hospital once in a month. That is appointments. Then if their crisis come, anytime the crisis come, I normally rush to hospital. And immediately I reach hospital, they normally attend to us, like the university teaching hospital. Immediately we just reach there. Immediately they know that this child you brought is a sickle cell. Many doctors will try to attend to prevent life.
Okay, to prevent loss of life. Yes. Okay. So back to you, Dr. Prof. From what she said, she has two that are SS. There's this elementary knowledge that some people have, that if you have a spouse who is AA and you are AS, and there's that crossing, of hemoglobin, you're talking about that, you're not likely to have more than one, SS. So in this case, how do you explain it?
Okay, so yes, people say that because if you do the crossing, usually the crossing is done for like 4. So they will tell you that, AS and AS is 1/4 that it will be. So maybe out of 4, it will be 1. But that's not it. You see, the crossing is for every index pregnancy. So every time the mother takes in, whatever happened previously doesn't count. It's afresh. So you can have 2 carriers, AS, man and wife, ending up with 4 sickle cell disease babies. Because at every time there is a pregnancy, it's a separate thing from what had happened previously. It has no relationship with that. So that is the misconception that people have. Okay? I use that as an example even before you. That look, 2 out of 4, that's 50%. So the thing to note is that every pregnancy is different. And you have a sickle cell disease baby at every index pregnancy. So you could end up with 4, you could end up with none, you could end up with 2, 3, depending on what is inherited.
So that's the misconception.
That's it.
You're just clear now. Okay, let's look at access to quality health care, really. Beyond the intervention you're talking about, which your group is doing at the moment with that funding support, how easy is it for Nigerian women, families to access health care for sickle cell warriors? Is it a service that is available in our hospitals? So, whether it's private or public?
I think in most hospitals, I would say in most hospitals, you have levels of care that can be given. Now, of course, some places will have more specialist care than other places, maybe because of the caliber of expertise that they have there or personnel there. Okay, for instance, it's not every hospital that will have a hematologist, but a basic any doctor can give some level of basic care to sickle cell disease, and even beyond the doctors, a nurse, a matron can give some level of care to a sickle cell disease patient. So I just said that we are working in primary health centers. Part of what we also do is to train the in charges there, the nurses and the matrons there. So because we know that some of these centers are the closest to the patients. So before, like you pointed out, in the middle of the night, before you start driving kilometers to a teaching hospital or something, you should be able to go to the primary health center, and depending on their assessment, if it's something that can be handled at that level, they will be able to do it. So we talk about tiers of care for sickle cell disease. So there are certain things that the mother can do at home because she's trained to a certain extent. There are certain things that she knows, beyond this, I cannot continue to nurse at home. Let me go to a primary health center. And the matron there will be able to do something and say, at this point, I think I have to refer because it's beyond this, and then send to maybe a secondary or a tertiary. So there are various levels of care. And I think relatively that the access to care is much better than it used to be. Because I guess with a lot of things, awareness and involvement of even the government and all that is better than what it was previously. So there are avenues for them to access care.
Okay, let's talk about quality of tests, really. And I'm asking that, I don't know how it is now, but I had a friend years back who said that she got into this trouble because she had gone for a test and she was told she was AA, at some point in her life, and then her spouse was also told it was AA, only for them to get married and discover that, one of them was a carrier, and that was how they ended up with a sickle cell warrior. Mm-hmm. So, how is it now? Can we be certain that if you carry out that test before you get into that relationship, that you have a correct, result? Really?
I think that's also one of the challenges. The challenge of diagnosis. Okay, I talked about various challenges, social, economic, and all that. There's also the challenge which is under the medical hand of diagnosis. Yes, there are situations where there's been misdiagnosis, and not necessarily because such places, apart from the issue of expertise, not necessarily because they don't have the bed, because of the technique used. Sometimes it's subject to is subjective sometimes in terms of interpretation. Yes, there are problems with diagnosis, but I think it's much better now. If I may speak about the program that we are running, which I dare say it's something that the Federal Ministry of Health is speaking of in terms of newborn screening. Okay, they've also not too long ago they established some 6 centers across the 6 geopolitical zones. So they are keen on it and they're adopting certain measures to improve newborn screening. Now, the tests that we use, they usually use screening test, and then there's a sort of diagnostic or confirmatory test. So when we go to the primary health centers, we just do the screening test. Anyone we identify, we go ahead to confirm the diagnosis. Now, for people who have such challenges, they probably went to centers. And that's been something that I know maybe for the age of the person, your colleague or your friend and everything, it's something good. But previously, people just walk into any lab and then they give them.
Thank you for watching. If you're new to this channel, consider subscribing so you won't miss out any of our latest video.